Good afternoon, Liam Domanic. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET-speaking roleplay.
Good morning. I'm Liam Demanek, one of the nurses here in the emergency department. You look quite uncomfortable. I'm so sorry you're not feeling well. I'm going to take a moment to understand what's brought you in today, and then we'll figure out the best way to help you. So, to begin, could you please tell me in your own words what's been happening?
Oh, good morning, Liam. Thanks. It's just my stomach. I've been having really awful pain, and I've been throwing up a lot. It's been a terrible night.
I can certainly hear the distress in your voice, and that sounds incredibly unpleasant. Try not to be worried. You are in safe hands. Before proceeding, could you please tell me your name and age for the documentation?
Yes, my name is Mihiraa. I'm 36 years old.
Thank you for the details, Mihiraa. To help us understand exactly what's going on, I need to ask you a few more questions about these symptoms you're experiencing. Knowing the details will help us determine the best course of action. So, could you please tell me about your symptoms in detail?
Well, it started in the very early hours of this morning, maybe around 2 or 3 a.m. I went out for dinner last night around 8 o'clock with my family. We tried that new Chinese place. I had the sweet and sour chicken, and it seemed fine at the time. But then, in the middle of the night, I woke up with these terrible, cramping pains all over my belly, and then the vomiting started, just like that.
Are you experiencing any other symptoms?
Yes, definitely diarrhea. Loose, watery stools, probably 5 or 6 times. I've felt a bit feverish, but I haven't taken my temperature. And yes, the dizziness. Every time I try to stand up, the room spins, and I feel like I might faint.
I appreciate you giving me all those details, Mihiraa. That's very helpful. With all that vomiting and diarrhea, I'm a bit concerned about your fluid levels. Have you been able to keep any liquids down at all since this started?
No, not really. Every time I try to drink water, it just comes straight back up, almost immediately. I'm incredibly thirsty. My throat feels like sandpaper, and my lips are all cracked. And I haven't really passed much urine at all. Maybe just a tiny bit once or twice this morning, and it was quite dark.
Thank you for letting me know, Mihiraa. That gives us a clearer picture of your hydration status. Now, before we go any further, I also need to ask a little bit about your general health background. Do you have any existing medical conditions?
No, not really, Liam. I'm generally quite healthy, thankfully, and no allergies that I know of.
That's reassuring to hear, Mihiraa. Based on what you've told me, it sounds very much like you've got a gastrointestinal upset, possibly what we commonly call food poisoning, especially since you mentioned eating out recently. To figure out exactly what's causing this, and to make sure we give you the most appropriate treatment, the doctor will want to do a few tests. First, we'll begin by checking your vital signs, things like your blood pressure, heart rate, temperature, and breathing, just to get an initial assessment of your current condition. Following that, they'll likely order some blood tests to check for signs of infection and to assess your hydration levels. We might also need a urine test for similar reasons. Given your symptoms, particularly the diarrhea, a stool sample will be very important to identify any specific bacteria or viruses that might be responsible. If your symptoms are very severe, or if they persist or worsen significantly, the doctor might consider imaging like an X-ray or an ultrasound, but that would be a decision made after their initial examination. Do you have any questions or concerns about any of those tests or anything else we've discussed so far?
Oh, that sounds a bit unpleasant. But no, I'm just so keen to feel better.
I understand, Mihiraa, and we'll make sure you're as comfortable as possible. Now, while we're waiting for the doctor, I'd like to share some important advice about food safety, especially since you mentioned eating out. When you're choosing where to eat, it's always wise to be a little cautious, particularly with places that serve street food or offer raw or undercooked items. Pay attention to the overall hygiene and cleanliness of the premises. A clean environment often indicates good food handling practices. It's also crucial to make sure that any hot food you're served is actually piping hot all the way through, not just lukewarm. If you ever find yourself getting sick after eating somewhere, and especially if your symptoms persist or seem unusual, it's a good idea to report your concerns to the local health authorities or food safety body. They can investigate if there's a wider issue.
That's really good advice. Thank you, Liam. I hadn't thought about reporting it, but I definitely will if this doesn't clear up soon.
You're very welcome, Mihiraa. To start, I just need to get your vital signs. Would you be comfortable if I just took your blood pressure, temperature, and checked your pulse now? It will only take a moment.
Yes, please. Anything to start feeling better.
Great, thank you.